So concerning the COVID-19, we already said in the beginning about some impacts on the effects we recorded in the different methodologies applied in Reggio Emilia, Florence, Sassari, and also it was mentioned Matera by Michele. It is something that we recorded as a different kind and different level of impact. As Andrea said, we from Florence, there are already a few studies, few researches, and also analysis on how the COVID-19 is affecting people since the point of view of physical dimension of the problem. I mean, there is of course one aspect that is connected to the what is making people more weak in front of the COVID-19, but this is a specific aspect that is approached by researchers and in particular health system that is recording this kind of data. And as we know, many causes of becoming more weak in front of the virus is a list of pathologies, like, for example, just obesity, as you know, diabetes, hypertension. There is a lot of this kind of very common kind of pathologies that are let's say, facilitating the virus to attack a human being. So this is, let's say, an analysis that is for doctors, for researchers that are starting to create researches and data. So I know that there is a list of researchers that are already available, and gives us a lot of new elements to understand how also physical activity can be a very valuable thing to do and to exercise in order to fight virus disabilities created by the virus itself. But there is also all the part that is connected to the social impact, and also the physical, let's say, the physical impact of the COVID-19 that we mentioned before when we talked about the different methodologies tested by local committees. WISP local committees, and specifically what have been recorded is that people started to develop, due to the restrictions that were imposed by the lockdowns and different closing phases and limitations for movement in the towns and elsewhere. All these elements created a new awareness in a part of citizens. At least this is what we recorded in our experience. Some people start to understand and feel more how these limitations on physical movement have created a very bad feeling, also since the point, not only from the physical point of view, but also from the social, psychological point of view. I think that all of us, we have tested this kind of feeling, especially during the very strict lockdown when we were not allowed to move around for example, in Italy, we had this kind of limitation. I suppose that it was the same in other countries, but we were not allowed to leave our house more than 1 kilometer just to reach with a specific authorization, a paper, a self-declaration that says that you are going just to buy food or to the pharmacy or to some special need for work or health reason. But in this time, it was really it has been expressed a lot, the need to the need of movement, the need of physical activity. And our activities that we mentioned from Reggio Emilia, from Firenze, from Sassari, many of them continue to be active during the COVID pandemic time online. And in particular, as I said already in the beginning, the elderly people have been, let's say, in contact with our operators that manage these kind of activities in neighborhoods and condominiums and elsewhere, trying to maintain this, trying to give them the a reason to continue to do something and be physically active. And so any sofa, any chair, any bottle, any tool have been used in the house to be physically active. We had a lot of videos realized by our operators that were shared via TV, local TVs, channels, or of course online or WhatsApp or other Instagram or other tools, social media and many other tools, just to be sure that this will be something that can make people maintaining their physical activity at least at a minimum level that is really needed. But the video itself wasn't enough. What was the result of this, let's say, our perception of what was the impact of the COVID during the COVID restrictions and also after, is that the relationship between our operators that were managing the activities in the neighborhoods and in the condominiums, etc., their relationships directly with their with the participants in the activities that were already involved in the activities have been very important in online live meetings. So a lot of activities have been even continued during the lockdown and during the hardest restrictions. Especially during the time we had all facilities, sport facilities closed. It was 7 months time that were all of them closed, so gyms and swimming pools and others. So in this period, this relationship online was developed, and let's say that also the capacity of our operators was and our trainers, our coordinators was very important to be able to learn themselves how to manage this online communication. And so this is something that we have to consider also as one of the impacts of the COVID-19 on these activities. After, as Andrea said, and me too, I said in the beginning, one other element that is important of the in the list of impacts by COVID-19 is the need to adapt our activities, our activities in the neighborhood, our activities in, for example, the walks in Florence or the other activities we mentioned in Reggio Emilia or Sassari. Because we need to separate the groups first of all, have to be registered. We have a registration of people that wants to participate in activities. Unfortunately, is not possible to guarantee space enough for people just announcing when and how and at what time it will be the activity, as it was before the COVID-19. So before we just leave a message saying that at that specific time we will meet in that place and we will start our work, for example, or our activity. Now we have to say this will be the time and the day and the place, but you should register yourself in order to guarantee that the number of people that will participate will be not too large. And in case it is very large, it will be split in 2 or 3 or more groups, and this will require more operators in order to guarantee that they will be followed in a proper way, as Andrea said in his answers. He said that it is important, the role of the coordinator of the activity, because, and the trainer and the person that is managing the activity, because the person, her or he role is really clear when they need to guarantee that things are developed in a way that is not too fast, not too hard, and especially after a so long time that oblige people in a sedentary situation, in a forced sedentary condition. So this is this impact concerning our activities by the COVID pandemic means also that the costs of the association grow in order to maintain this kind of activities, because if you need more operators, it means that you need more compensations for these people to work if they are not volunteers and they are people that do this for job as it is. Then, of course, the other consequence of the COVID-19 is that is a positive, let's say, element or consequence. It's the fact that, as I said already today in the morning, in these walks or activities, physical activities we realize in the neighborhoods, we used to have now to include now also doctors or psychologists or specialists on particular cases or needs. For example, for women, we have social assistance that is professionals from the social assistance system that are part of the participate in the activities in order to be able to answer to questions, to give suggestions, to give support to people who needs a kind of support and also help. These are, let's say, the very briefly the part of the impact of COVID-19 on the activities. But I would like that Daniela, if she is online now, do you hear us, Daniela?
Yes.
Yes, Daniela.
Good morning, everybody.
Ciao, Daniela. I introduced you in the beginning of the meeting, saying that you are the new responsible for intercultural relations, let's say, but you will describe it better. But you are, since a very long time, expert in a lot of things we are discussing today. And in this specific case, we are asking you to contribute with the experiences you recorded also at Roma level, because in fact you also are a leader of the local committee, and I think you can share a lot of things that can be useful to understand all our activities and how they are affected by COVID-19. Please go ahead.
So thanks a lot, everybody. Also, my cats won't participate in the discussion. And I think that this morning you've got a very, very good and productive training, and the things said are really a lot. As Raffaella said, this COVID leave us some positive things, even it's not positive, the pandemic situation we are living. But what we observe is that people and more associations started using also electronic device and multiple way to stay in touch with people and offer also sport activities. I know that all the organization involved did the same. And what we observe, for example, in Rome, we've got a very large group who work with old people, is that at the beginning it was very difficult for them and they feel really lonely. So many of our sport educators just phone them and try to give them more psychological and social support, because it was impossible for them to have the visit of their nephews or sons and daughters. And so it was very, very hard. And so they try to establish a network in this sense. But when this old people was able to use the device, because maybe they learn how to use WhatsApp, for example, they start to create a WhatsApp group. And then they learn how to use the videos or the Zoom connection, and they were very happy of this. And Francesca is one of the coordinator we've got in Rome, report us that many old people start stay together and using the same device just to be in contact. And they ask not only to do sport, but also to talk, because they need to talk with people. And that was very positive. Another thing was a nice idea came from our responsible of dance sector, and she invented, in Italian is danzandando, and is dancing, moving, listening music. And she's got this idea to ask people on Sunday morning to have a walking with their mobile phone connected, and she and another guys expert of music, Catherine music, they propose music and rhythm, different rhythm from different part of the world, and they present also the culture, and the people walked listening this music. And so it was an idea to combine socialization, attention to your other culture, and stay together. So all these things was very positive, but we have to analyze also some critical point, and I just want to present you some flash. I think that many of you experimented how this pandemic enlarged the discrimination in our country, and that is especially with people who cannot have access to the device, to the multiple device that we used. And this is in particular for poor people. And I think it's the same in your country. We observe this also with the kids, with school done in front of the computer. We've got large part of the young population who cannot attend because they don't have connection or good connection. They don't have good device. And when we are closed in a house, and maybe you are many people, and you don't have enough computer, because if your father, mother has to work on smart working, you have to follow the lessons, and your brother or sister has to do the same. And in some case, there are people who live in a very small house with one common room. So it becomes very difficult. And it was the same for sport activities. And I was thinking also in particular to migrant and more in refugees and asylum seekers, that they live in a refugee center. And what we discover, especially with our sport clubs who work directly with them, and in particular Liberinantes, that many of you knows, is sport clubs in Rome who work specifically with refugees and asylum seekers, is that they cannot any access to Wi-Fi connection, because in the refugee centers there's no possibility for them to use it. It was only for sport educators for many reasons, because there's not a large band, or because it's not a very good connection. The reason are many. In some case the educators just don't want. And so we discovered that they remain closed in their room for hours without doing nothing, because whenever they use the phone, even for calling the families or for sharing Facebook activities and so on, they consume all the giga that they have, and so they have to buy, and sometimes they don't have money enough. So what many sport clubs in Italy did was to create Facebook group just to share ideas, thoughts, just to say hello, everything is okay, with the people they work normally with sport activities. And because it was really impossible to propose online courses or just send the videos. So what Liberinantis did, for example, was to contact some of the big society like Vodafone or this international telecom of these providers, and submit the question. And they send a lot of letters in which they said, we got this problem with the refugee center. Can you offer for free the connection? Because last year, especially in Italy, there were this solidarity run to offer for free services to population, like visit the museum for free, or listen or video, or for example, Sky offer for free film and sport and so on. And they just asked this, and Vodafone reply, and they give for free connection in 3 welcome center in Rome. Of course, is not enough. We are talking about 200 people, but this is a way also to think how we have to reflect how pandemic was terrible. And another example is, for example, for prisoners. Maybe you know that we work in many prisons in Italy, providing sport activities. During the pandemic, the prison was closed, and in this moment, in some places are still closed, and it was impossible to provide them any support, because they don't have any the meetings with the parents. And so in some cases, the prison, after a big revolt, they give them the possibility to have the colloquium with the family via computer, but they refuse any other opportunity for the prisoners to do school activities or sport activities in video. In some cases, we try to send the prison some DVD, but not in all the prisons that was possible. We are working actually on an Erasmus Plus project in this sector, and we know that in Belgium, for example, this was possible, not in Romania, not in Bulgaria, not in Croatia. So we know that these are another large part of the population that was completely excluded and locked down in the lockdown, we can say. And so I think that this experience, very tragic, should learn us a lot of things. First of all, that innovation is important. Secondly, that this idea that Next is proposing, it's really a winning idea, because we are talking about social relationship in a neighborhood, and this means that you can create connection into people, with the people. And for example, another things that we observe is that where there was a big connection in the neighborhood, people help each other. There are people who take care of the neighbor, bringing the food, for example, if they cannot, or bringing the medicines, especially to old people that cannot go out. Where you don't have any real connection, you experiment really the loneliness of the people, and that's happened also in this COVID situation. So I think that we have to be very open in analyzing the situation, seeing the positive things that we learn. So using new devices, using creativity to propose a project, but also which were the criticity, and think that is not only saying I'm proposing you sport online, you solve some situation, but analyze which kind of necessity and needs has the whole population, especially the most fragile and the people cannot have any access to normal life. So that's